Dr. Sushank Bhalera.
So, good morning everyone. I'll be presenting on rare ocular injuries by bird beak, its visual outcomes and factors affecting it. So, bird-related eye injuries are rare and majority of them goes unreported. Most of them are by owls and rooster. Children are naturally curious and particularly drawn to attention to that living creatures, and roosters have a known site of child's eye as a site of attack. It can lead to retinal detachment, lens abscess, traumatic aniridia, post-traumatic endophthalmitis, phthisis, and early wound repair, iris abscission, and vitrectomy should be done, and serial B scan and perioperative antibiotic should be given. So we aim our study to evaluate the outcomes and identify the prognostic factors in patients with ocular injuries by bird beak treated at the tertiary eye care center in South India. It was observational study approved by IEC, and patients with bird beak injuries between 2011 to 20 were taken in study with follow-up of 3 years. We collected data on age, gender, mode of injury, and size of laceration. And examination we did was visual acuity, slit lamp, fundus, and B scan. Appropriate statistical tests were used, and p-value less than 0.05 was taken as significant. It was 27 patients, 18 were males. The average age was 20.46 years, and the mean length of corneal laceration was 3.96 mm, and visual acuity was better than 2016 4 cases and worse than 2200 in remaining 23 cases. No perception of the light was noted in 5 cases. So it was rural in population in 16 cases, and bird beak was causing injury in 25 cases, scleral involvement in 3 cases, infected tear noted in 5 cases, hyphema in 6 cases, iris prolapse in 4 cases, non-iridia in 2 cases, and vitreous prolapse also in 2 cases. Traumatic cataract was noted in 5 cases, retinal detachment in 2 cases, endophthalmitis in 7 cases, and surgery required in 18 cases. One surgery in 18 cases. So UCVA was a significant factor. Also, length of the tear, lens status, and duration between trauma and surgery was a significant factor. The true incidence of such injuries is largely unknown. Hence, our study is making significant in contributing to know its incidence. So, surgical intervention was done in 66% of cases, like corneal laceration repair via surgery, cataract extraction were the most commonly performed surgeries, and repairing can be challenging also due to their complexity and potential loss of tissue. Some required second surgery too. So traumatic aniridia, traumatic total iridectomy was there in some cases, and ocular injuries caused by bird beak often result in endophthalmitis. So dirty wound, delay in primary repair, ruptured lens capsule are independently associated with development of post-traumatic endophthalmitis, and our study observed 25% or 26% of cases, which was higher as compared to other studies done in past. So length of laceration, lens status, duration between trauma and surgery were our factors which were significant, and limitations of our study are retrospective nature and small sample size. Coming to conclusion, prompt management and appropriate intervention is the key in bird beak injuries like other injuries, and a critical role of timely surgical management and avoidance of multiple surgeries within first week should be understood. And we also identified prognostic factors like initial visual influencing the initial visual outcomes, which include tear length, lens status, and time interval between trauma and surgery. So role of public awareness to prevent these untoward injuries also plays a role. Thank you.
Exactly.
Any
He
culture
said
reports available?
all and
Yeah,
rooster, but all
two were having fungus, and
get
remaining
more
were
fish
in 2
came out
cases
back
no
then
organism
rather
was
than
noted,
bubble
and
then
3 had a gram positive bacteria.
No, we didn't understand how exactly it happened. What is bird beak means? What birds? What happened? I mean, how can it be so severe? Like,
Yeah,
I mean, did you
it's
really
like
go into the actual incidents? Because if you want to prevent it, we should know how it happened.
in some villages, what the children used to play, they used to get these small roosters in 5 rupees. So usually their parents used to give them to play with them. So they buy that 5 rupees ka rooster, chota chota, and then children used to play. But while playing, that rooster suddenly come to their eye. So most of injuries were like that, and it's very common in villages of Andhra. They're a common game. They used to give it to kids. Yeah, just suddenly while playing they come to their eye. Most of the cases were like that.
Roosters
Very
are
few
also
had
school
some
going.
accidental injuries.
You said alls. Is it that common? What bird you said? Except rooster, what extra bird you added in your slide? You said rooster one and
Yeah,
another.
most of them were rooster.
What are others?
In 2 cases there were like bat injuries, but that was other cases. Most of them were 80 to 90% were roosters, especially from villages in Andhra.
Children usually.
Hmm?
And children usually?
Yes, usual children, mostly are children.
Very interesting.
Thank you.
Probably that is related to that cultural thing. Probably that villages, as
Yeah,
you said,
mostly.
it's a play thing for them.
Yeah.
So
mostly.
could be that.